examination is going to go through 3 phases. During the first phase, which will last for 15 minutes, you are going to tell us what you did. And after that, we'll go to the second stage where we are going to discuss with you, probably to get some more clarifications. Ms. Akah Thelma Eni, we are at 5 minutes to 3 p.m. I will now invite you to talk to us within the next 15 minutes. You are welcome.
Good afternoon, President of the jury, honorable members of the jury, distinguished guests, I greet you all. I am Akah Thelma Eni, presenting on the topic Effects of COVID-19 pandemic on the utilization of healthcare services, precisely diabetes, hypertension, and malnutrition in the Bamenda and Boya Health Board, supervised by Associate Prof. John and co-supervised by Dr. Zambe. My outline runs from the introduction down to the reference, as written by Akah Thelma. It is mainly utilization, describes the use of healthcare services by the people for the purpose of preventing and curing health problems. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and the nerves. The most common type of diabetes is the type 2 diabetes, which occurs usually in adults when the body becomes resistant to insulin or doesn't make enough insulin. Hypertension, on the other hand, is when the blood pressure is too high and it is diagnosed when it is measured on 2 different days. Malnutrition refers to deficiencies, excesses, or imbalances in a person's intake of energy and or nutrients. It has been reported by HAPI that among patients who died from the coronavirus infection, 30% had diabetes, and in particular for hypertension has been widely recognized as an independent risk factor to the severity of the COVID-19. Although COVID-19 mainly affects the health of the elderly population, the pandemic has significant consequences on the nutritional status of children. From studies done in Addis Ababa and southwest Nigeria, together with other related research on the impact of COVID-19 on health services, it has indicated that there is a decrease in the patient turnout at the hospital during the pandemic as compared to before the pandemic. As the COVID-19 pandemic continues, many studies have reported major changes, different effects, and challenges during this period in the utilization of the healthcare services. So due to these changes, which included large reduction in services, particularly in cases that were hit hard by the pandemic, but also some selective increases, such as for telemedicine. As such, many people have missed out on much needed care, such as vaccination or life-extending interventions. And so, since little or scarce information is available from the Bamenda and the health district, this has prompted the initiative to do the research in these zones. For the rationale of the study, our study was assessing the effect of coronavirus pandemic on the utilization of healthcare services before and during the pandemic. This will provide information that can be used to take measures in promoting or improving healthcare utilization. For our general objectives, we aim at examining the effects of COVID-19 on the utilization of healthcare services before and during the COVID-19 pandemic in the Bamenda and Boya Health District. Specifically, we were assessing the pattern of healthcare utilization before and during the COVID-19 pandemic. We were also assessing the effect of the COVID-19 pandemic on health services, and also we were identifying the challenges that were influencing the utilization of healthcare services during the COVID-19 pandemic. For our materials and methods, our design was both retrospective and cross-sectional, whereby for the retrospective data we used an extraction form for the collection and we administered questionnaires for the cross-sectional study. The study settings was the diabetic, hypertensive, and the nutrition unit of a public and mission hospital in the Bamenda and Boya Health District. Our population included the records of patients who utilized the diabetes, hypertension, or malnutrition service from 2018 to 2021. Participants comprise the healthcare providers working in the various units of the Living Public and Mission Hospital in the Bamenda and Moya Health District. We calculated our sample size using the Cochrana's formula for the cross-sectional study, and we had a minimum of 386 participants. While for the retrospective study, the sample size wasn't calculated, but completely filled records which met the inclusion criteria. We used a multi-stage sampling technique. Firstly, a non-probability convenient sampling was used to enroll the hospitals, and then a random probability sampling technique was used in the selection process for the hospital workers of ages 18 and above. We obtained our ethical approval from the Institutional Review Board of FHS University of Goya. From there, we got our administrative authorization from the regional delegations of public health in the Bamenda and Goya Health District. From the health districts, we also obtained administrative authorizations and also from the Faculty of Health Science. Pre-testing of these questionnaires was done at the Bakusa Regional Hospital, and adjustments were made, and the final copy was administered for the collection of data. The data was then managed and analyzed. Our questionnaire was divided into 4 sections. Section A was the socio-demographic characteristics, Section B, the effects of COVID-19 on healthcare services, Section C, challenges influencing the uptake of healthcare services during the COVID-19 pandemic, and Section D, evaluation of healthcare services affected by the pandemic. We included all the professionals directly involved in patient care. Also, all patients registered with complete information in the registers for the type 2 diabetes, high blood pressure, or malnutrition were also included. We excluded those who had both type 2 diabetes and high blood pressure, and also children who were above the age of 5. And also, all students in the various professional fields or staffs who were not directly involved in patient care, together with those who do not consent to participate. For our data management, all of the questionnaires were verified to check if they were completely filled. Data was entered and cleaned in Excel. Data analysis was conducted using descriptive and inferential statistics. Continuous variables were computed using means and standard deviations, while categorical data were computed using frequencies and percentages. Comparison of the utilization of healthcare services before and during the COVID-19 was performed using the chi-square test. A statistical significance level of 0.05 was assigned for all statistical analysis. Statistical package for social science software tool version 27 was used for the data analysis. Members of the jury, distinguished guests, these were the results we got from this work. 8,200 files were reviewed. 4,090 met inclusion criteria for the diabetic patients, while 2,910 met the inclusion criteria for the hypertensive patients, while the malnutrition, 600 files were reviewed and 491 met the inclusion criteria. According to our Objective 1, as we are assessing the pattern of utilization of healthcare services before and during the pandemic, we observed that there was a significant difference for diabetes, mellitus, hypertension, and malnutrition. For diabetes, there was a 6.6% drop in the patient turnout. For hypertension, there was a 1.93% drop, and for malnutrition, we instead noticed an increase in the utilization by 22.2%. Graphically, we observed that for diabetes and high blood pressure, during the peak of the pandemic in Cameroon 2020, there we observed a drop in the patient turnout, and the significance of the significant difference before and during the pandemic is related to a study done by Manhor, whereby there was a difference, or he observed a difference in the utilization of the diabetes services before the pandemic as compared to during the pandemic. But this proposes work done by Suraya et al. For hypertension, there was a difference and a significant decrease during the pandemic as compared to before the pandemic, and this was similar to a study done by Umar et al. But proposed a study done by Seo et al. Where for malnutrition, we instead noticed an increasing trend from 2018 right up to 2021, and this is similar to what done by Paulo et al. For objective 2, for assessing the effects of the pandemic on the healthcare services, we observed that 25.1% of the participants indicated that their departments were temporarily closed due to the COVID-19. 90.3% indicated that they could not commence compulsory annual leave due to the COVID-19, and 90.3% also indicated that the pandemic has impacted the utilization of their healthcare services. For the final objective, which will identify the challenges that influence the uptake of the healthcare services, we observed 3 key challenges, which were the fear of nosocomial infection, government policies, and the fear of stigmatization. While the 3 least challenges that the study got was long waiting times, lack of available trained personnel, and lack of available infection control and prevention services. For the evaluation of healthcare services affected by the pandemic, the participants perceived the low majority of the participants perceived the low turnout of patients, while majority too of these same participants agreed that the patients were satisfied with the type of health services they were receiving. In conclusion, the health system has been affected by the pandemic, and there has been a significant drop in patient utilization of healthcare services during the pandemic as compared to before the pandemic. There has also been a negative toll of the pandemic on the healthcare service provision. Some major challenges have been identified in this study to have influenced the uptake of healthcare services during the pandemic. We recommend that the Cameroon Ministry of Public Health should enforce sensitization and training with respect to COVID-19. More efforts by the hospital administration should be geared towards the strengthening of essential health services to support and respond adequately to emerging emergencies. Further research should be done from the perspective of the community for better policy making and proper preparation in case of another pandemic. As the strength of our study was that the study gave us an insightful picture of the effect of the pandemic on the healthcare utilization during the lockdown from the perspectives of the healthcare personnel. While we were limited because the both regions or the both study areas were affected by the socio-political crisis, which affected the researchers during fieldwork. These are some of our references.
Okay, thank you so much, Dr. Thelma, for your presentation. We have lots of time, so we need to master the presentation. So this brings us to the end of the first segment of the examination process. We are going to begin the second segment, and it's now my pleasure to invite the operator to read us.
Dot the I's and N's. I would first like to ask what motivated you to conduct the study? The motivation for the study?
My motivation was the whole mobility of COVID-19, diabetes and hypertension. And then my grandfather is diabetic. So during that period, even during crisis, it was difficult for them to go to the hospital. And the main thing was because there was this stigma that when you go to the hospital, the next thing they went to diagnose you is that you have COVID-19. So I decided to work on it.
Thank you. During your presentation, I heard you talk of a large reduction in services or in service provision.
service provision, that was from work that others haven't done. Some people went through all the health units or health facilities or analyzed all the health departments, and then the general conclusion was that there was a decrease in the usage of healthcare services during the pandemic as compared to before.
Usage and provision are two different things. You said that reduction in the provision is different from the usage. They are services that people are utilizing or accessing them on so which one are you talking about? The usage. So you check that out correct. So we think of mission hospitals or private hospitals. Go to slides 11, 12, and 13. Just go to 11 first. I want to say generally you have issues with the usage of upper and lower cases. You try to correct that next time on your slides. Bamenda and their health district, the age there should be in caps as well as the team. Move to the next slide. We talk about mission, public and mission hospital. And there is somebody this like the team. And here, we're talking about private public hospital. So even in their work, it's confusing. Which hospital is it working with?
What is mission?
Not private. Just mission, not public.
All the public and mission.
Okay, thank you. We'll go through your work. We'll start with the cover page. I'll first of all give general comments and then we go to specific aspects. That's right. And if it be, I'll ask a few questions. So I only talk about issues for the usage of upper and lower cases, right? Right on the cover page, you can see that the supervisor is an associate professor, not right? You see the associate professor. Okay, you see the other corrections there pertaining to grammatical. Your abstract too is not where it is. It should come after acknowledgements, okay? Then make sure you include, there are so many abbreviations that are not on your abbreviation list. Please make sure you correct after you have added the field, the go through your work and include them, okay? Your abbreviation move on to the next page. There is no heading, so you don't know what is on the side. The abstract is supposed to be page 4, please. Your method there you said you use a descriptive / analytical method. So I'm asking what's the meaning of that slash? Is it an or is it an alternative? Are you saying that you use a descriptive or analytical method? Are you saying that? So which is which?
Descriptive and analytical.
So you correct that, okay? Okay, under the method still you have your questionnaire described in section. You don't need that please. Just tell us which questionnaire to collect data on this, alright? So if you remove that, you see that more in your method. And then you said a non-probability sampling method. Which one? Do you have just one? So you specify the specific one you use, okay? And I heard you talk about retrospective study and didn't indicate how did you collect data. So you should include that in your method section, right? Okay. Under results, the 3 key challenges that were indicated by health to have influenced the utilization of health services include fear of that it's not well placed. You have to face that okay. With results we want to see the percentages, right? tell us what percentage of participants reported that then your conclusion to is too general. So you should try to use proportion. Okay. Correct that I've indicated what we wish to do. Definition of terms. Ideally it's supposed to be in chapter 1, at the end of chapter 1, there is saying I don't know whether that's the order in your department public health. And if you define terms, okay, you need to indicate the sources. On this page there is no source, so where is the information coming from? I believe you know that you write and you don't cite. It's an academic, how do you call it? Yes, I don't want to call it. So make sure you cite sources, okay? And then this word challenges, I found it very difficult to understand. These challenges, so you need to define this under the definition of things. What the challenges, what you mean, what you're talking about challenges. And you should note that the page, the specification of margin, you have 3.5 on the left and 2.5, but you see that yours is different. You left more below, like about 4 or more. Please follow the UPs. This is the specifications, right? Okay. And we are using block paragraphing style. Not in all your work we indented, right? I got to 22 pages and I saw the block paragraph. So please go through and correct, okay? There's this sentence that I said it's not the other background. Coronavirus disease has emerged by a novel coronavirus, now known as emerged by. I don't know what to do. I'm trying to see that they correct that. There's also a strong statement on page 2 I've indicated the source. There are two. The source is very out of take much time reading. Okay. So as I said, to me, your third question or third objective should be factors. What are the challenges influencing? Challenges, difficulties influencing how? If you even go to your resource section, you see that that term does not match what you're trying to say. Think about it, okay? On page 5, we talk about the scope. And written there is incomplete. You will need to add the method again as part of the school, information on the school. And then your titles shouldn't look like sentences, please. I've implemented that. You have too many short paragraphs. Please, I have said them that you should make similar items. Okay.
I think if I permit me, that's a serious concern. I noticed that one sentence paragraph.
Okay, you have a handy figure here on page, on page 18. That's 2.10, management of COVID-19 on page 17, and then the next we see on page 18 is a table, but this table you have not referred the reader to that table. Okay, so you need to do that in the text that follows that comes before the table, right? You indicate like you are referring to page or to table 1, and the source for the table comes below the table, not below. If you see on page 20, on the same page, the margin is different. For the first and second paragraph, you have the same margin. And then for the next paragraph, that is different. So you have to do some formatting there, okay? Which referencing style do you use? So go to page 23 and tell me what referencing style. Have you seen the problem?
No,
You have not noticed on page 23, first and second paragraph, rule 2021. Have you seen that? It didn't do empirical review. Do you know what empirical review is? It's review of related studies, previous studies that are related to your objectives, to the topic that you're studying, okay? So you should do that, please, because it has really affected your discussion. Are you there? Okay, so you have to do empirical review as per your objective. Okay, let's go to chapter 3. You said your design is a retrospective data. That's your design. Listen, retrospective data was collected using a data extraction form. Is that a design? What do? You state your design. Okay, so we expect you to do that. Then the study area, you say study setting. So it's a little bit confusing. The area, and then you describe this, you move on to the setting, okay? Describe the setting. So I'll put the specified settings and describe them clearly. You worked where and where? Which units? Okay, fine. In the same units in both areas. Okay, so what you do is that you briefly describe these areas and then you go into details to describe the needs. Okay, bringing out their importance to your topic, your objective. Study population. Participants comprise, when you use comprise, you don't look up again, right? Consist of, composed of, you comprise all healthcare providers. Then you said the public, private, or mission. See, you're composing us. Have you seen that? Please be consistent, okay? Alright. Inclusion criteria. You have the evidence 3.4, inclusion and exclusion criteria. You said the second one, also all patients register the complete information. Did you recruit patients or you study their files?
Study the first.
So be clear about that, okay? Staffs, do we have heirs? All students, that's on page 30, all students in various professional fields or staffs who were not directly involved. And I asked, what do you mean by not directly involved and directly involved? These are some of the terms you need to describe or define in your definition of terms, right? And then operationalize it so it should be clear, okay? So there are some of these points you just check, okay? On page 31, you said the pre-test was done on the final draft of the questionnaire. Final draft of the questionnaire is the pre-test. So I'm asking, how was it done? You briefly explain that, okay? And then somewhere I saw talking of a pilot study, and I asked if you conduct a pilot study or you take a pre-test of the questionnaire.
The pre-test.
The pre-test also. So you remove this pilot study, okay? But I was asking if you did a pilot study, let's see the result even in the appendices, okay? So if you are very sure, no problem, you just need to see the results there, right? And the researcher, under ethical consideration, the researchers developed a research proposal and ethical approval was then sought. Was that the first thing you collected? So you write in order, because I'm not sure if you were able to get your ethical approval without getting something from the department. So you do that. Okay, I didn't also see anywhere you talk about consent for your participants. Please let us know, did they give consent? Include it there, okay? Okay, let's go to your results. You have good results where you have issues presenting them. Your results are good. The first page 35, what you have there should be taken to chapter 3, okay? On page 36, you are presenting two figures at the same time. It doesn't go like that. You said figure 5 and it should have been figures. But we don't really accept you presenting the two at the same time. Figure 5 and 6 below show that I accept present one at a time. When you talk about the figure, immediately see it also. Right. Then your tables have indicated normally your column for your frequency and percentage gain. Bench, okay. I've indicated that, please. And you make sure you present your text before the tables, right? Generally, there are some a few things here that are getting me confused. If you look at go to page 53. You of all 54, let us go to 54. I'm asking where is table 22? You said in the third there and you refer us the reader to table 22. There is no table 22 on that page 54. Are you there? Have you seen that? And when I turn the next page, I see table 18. How comes table 22? You're talking on table 22, you are presenting table 18 on the next page. Are you there? Have you seen that? Have you seen that?
Very last line. Very last.
On page 55. Have you seen that?
55.
Are you there?
Is your copy different?
Have you seen that?
No, it's not page.
Page 54. Have you seen that?
Okay, ma'am.
You are talking of page 54.
Oh, yes.
Okay, then when we go to page 56, you talk of page 24. There is no page, table 24, no table 24. We see table 20 the next page. What's happening? And then we still see mission private. Government mission private. Are you seeing that? So you are really getting us confused. We don't know what we're doing. This issue of this table is it's just, I don't know how to put it. On page 58, you have table 18. Then we turn the next page, we are seeing table 21. In me, what happened to you? Are you seeing that? The whole thing, you have mixed up everything. I don't know whether the tables are repeating or happening with you, and you have mixed up everything. Like I said, challenges should be factors influencing. And you see that you are presented, like the results are supposed to be a summary of your results. You cannot present everything. Okay? If you look at the table where you presented your demographic characteristics, I'm asking what's the significance of religion? What's the significance of marital status in this study? Did you analyze it? Did you do an association between participants and response? So you see, it makes the tables long, okay, so those things that are of your message, you are presenting a summary, not a whole result, right? So you look at that and correct, okay? So like I said, if you had done your empirical review, you would have had much to discuss. So then your results you have about how many pages? If you count 8 pages or more. No, more than 8. About 26 pages of results, and then discussion just 8. It's very, very difficult. You cannot go, okay? So go back and review empirical studies, okay? And then you select your main findings and present them, okay? You have very specific findings. The rest of the findings you can present, you can do publication. You must not present everything in this one, okay? So try and this collection. Thank you so much, Jay. Amy has demonstrated mastery of our work, and we expect that she may affect decoration to the thank you.
Okay, thank you for that review. We are very grateful. What we try to do here is to improve on the quality of the work. Nothing which we say should be taken in bad faith, because all of us are in a learning process. None of us here knows everything. And each time we pick a document, even the ones which we write, each time ourselves we pick it, we still find reason to change one or two things. So that's what we are trying to do. So whatever thing we are saying, don't take it in that way. It's just to improve and find more quality of this document. Right?
Yes, sir.
That should be understood in that context. I don't say that this teacher wants to run me down. Okay. Okay, I will now also go through my own comments, questions and suggestions. I'll try as much as possible to avoid being repetitive. I think some of the points she made, I also saw them and I took the advantage when she was talking to chip in one or two issues so that I don't come back to those things. Okay, I will also make general comments, then I will come now to make specific comments. Generally, she said it, but I think I must repeat this because it's important. You must use a thesis guide. Otherwise, when it goes to the library, they will send it back. Right? If you do not use a thesis guide, your presentation doesn't follow that path. So you must use it. To stress on that. Point number 2. In your table of contents, list of figures normally come before list of tables. Right? Even without thesis guide, list of figures normally come before list of tables. Do you know why? Okay, because F comes before T. Right? So you must have figures before tables in your content. Right? F comes before T. So you must have figures before. That's a general comment. There's another thing I wish to find out from you, and I've seen that. In fact, this is the third panel I'm sitting in today, and I see it in I've seen it in all of these three work which I read, and it has to do with healthcare. I've noticed that most of you, even on the same page, if you go to your abstract, for example, let us use your abstract and look at that. It's a good demonstration. If you go to your abstract, look at your abstract under results. Right? Are you there?
Yes, sir.
Lines 1, 2, 3, 4, 5. Line 5, towards the right side of line 5, you see healthcare services. Right?
Yes, sir.
Go to line 6, 7, 8, 9. Towards the end of that side again, you see healthcare services.
Yes, sir.
What's the difference between those two things? In one, the healthcare is written as one word. In the other, it's written as two words. Do they mean the same thing?
No, sir.
Then why are you writing them? The same thing you are writing in two different formats. Okay. You have to. You see the first one, healthcare services, right?
Yes, sir.
That's the right thing. The first one is correct. When you write it as a single word, it describes services or systems which we use to attend to patients. But when a doctor or a nurse or whoever is attending to a patient, it's separated. Health care. Right? So that is the difference between those two words. They don't mean the same thing. When they are written as a joint word, you are referring to the system, the hospital system, or the public health system. But when you write them as disjointed words, you are referring to the care given by the doctor, the nurse, the pharmacist, or whoever in the hospital system now. So don't be mixing them and you are writing them the same thing and turning them upside down. Okay, this just gives me the opportunity to talk on this abstract. I think there are many things, about 3 aspects I want to address on this abstract. We look at your methods under the abstract, right? Go to the very last 2 lines. We used a p-value of less than 5, 0.05, and a statistical package for the social sciences version lab. Is that correct? And Thelma. You have to rephrase that sentence, right? You have the information, but it's poorly presented. It's not good. That's not good writing. You have to rephrase it. Okay. We also look at the very first line of your result. There has been a drop. There has been a drop. You are reporting this thing. This your story has ended. Right?
Yes,
So you cannot use present continuous. You said there was a drop, not there has been a drop. Right? It's not English 101. This is science. Right? It's not English 101. It's science. Okay, one thing I want to ask you now, which links to this thing, I asked this question here because I was not too sure when this study lasted. Because you said the diabetic hypertension, that is under conclusion, the diabetic hypertension and malnutrition units have been affected. A similar type of thing were affected. But the question I want to ask you is that from your presentation now, I noticed that this study was, you will review records from between 2018 to 2021. 2018, am I correct? Why? Why did you bring 2018? When you are talking more on pandemic. 2018, did we have pandemic? So why did you bring 2018?
After the number of years of review, 2 years before and 2 years after.
Oh, 2 years before the pandemic. Okay. You'll be able to see where the changes are taking place. That's scientifically. So but you now see that 2018 to add another situation which would have affected this result somehow. Between you and I, 2018, could you go to your village? So all those health centers around those areas where people go, where people access healthcare. So this 2018 has another factor which would have played in the data which we finally generated. Because 2018, we're all running letters every day. We didn't know where we were running. So I don't know, you may want to take a look at that point I've just mentioned also in your discussion. I think you tried to mention in your limitation. Yes. See, I saw something like that, but maybe you can bring more points to add on to that. So I will give some more reason for some of the observations we have seen from this program. I am on page, the materials and method, page 28. If you look at the figure 2, map of our health district. I want to imagine that in epidemiology, or public health and epidemiology generally, you cannot just present a map like this. Go to the next page. What's the difference between these two maps?
The first map is sketch already. The second map is a bit repetitive.
Which one is correct? Not a guess. Which one is correct? Public epidemiology and mapping of study sites and all the things. Yes, you cannot have the health unit or health area without an extract from the map of Cameroon. Right? So the map on the next page is the correct thing. But you see that you did that for Bamenda Health District, then you did not do it for Boya, and you were doing the same thing. So why should you do for one and you didn't? So you have variation to different ways of presentation. But the one in the second, the Bamenda is the right one. That's what it should be. There must be an extract from Cameroon. They are not hanging in the air, they are within Cameroon. Right? So you must be extracted from it. And And you see that the one for Bamenda, you see that map of Bamenda Health Care. The one for Boya, you see the map of Boya Health District. Are they both, or maybe I don't know, are they not both health districts? And then the Bamenda Health District, you did not describe it. You did not. You described the Boya Health District, but the Bamenda Health District, you did not describe it. Which is very important for such a topic. Yes, it's very important. So you must describe it. And it goes down to the page 29, inclusion and exclusion criteria. I am on point number 2, inclusion criteria. I think Dr. Eda spoke about this, but I'm still coming to it because I think there's something which I want to. She talked about it, but she didn't address the condition. Patient register with complete information, she talked about that in the register for either type 2 diabetes, high blood pressure, or malnutrition were included. My question now is that this malnutrition, was it for everybody or it was restricted? Because the way you're putting it as if it was for everybody. It was restricted to one category of person.
Children below the age of 5.
And then if you go to your next page now, you go to the point number 3, read it. Read that exclusion criteria.
Those with both type 2 diabetes and high blood pressure were excluded from the study, and malnourished children above 5 years of age were also excluded.
What of those below 5 years? Which you did not mention in the previous one, then now you are saying only those above 5 years were excluded. So it means you are missing a group, isn't it?
Yes, sir.
You are missing a group, which you must address. I am on page 31. The last paragraph. The last sentence. The questionnaire was designed to meet the objective of the study and will go through several drafts and reviews. I'm sure this was still a proposal, right?
Copy and paste.
You just copy and paste it. You did not revise it. This one now is defense, is not proposal. The result is I am on page 33. Ethical consideration. The first sentence, the last line, you see all these sentences, one sentence paragraph, one sentence paragraph. It's wrong. You have to mention all those things. She said it before. But my point here is this. From the Institutional Review Board of the University of Boya, is this statement correct? Institutional Review Board of the University of Boya. Is this statement correct? From where did you get your ethical clearance?
Institutional review.
Where? Of health sciences. Yes, these are two different things here. Don't think that because health sciences University of Boya, they mean two different things because a university institutional board is almost being finalized. So at the end of the day, maybe they will merge, I don't know. But it seems most likely they will merge. But the way it's presented here now, you are giving that is the university. It's not the university. It's the faculty of health sciences. I agree, right? All right. I think most of the points I picked for your results, Dr. mentioned, she has talked on most of them. The point I want to make here is that I told one of your colleagues this morning that I am of the old school age, right? I'm not very good in biostatistics. When we were doing science that time, all what you have now that they will tell you this, and you do not see them the way you are seeing it now. But my instinct tells me that the statistics here is below standard. It's low because you are looking at predictors, you are looking at risk factors. And then I'm just seeing chi-square. Did you verify the statistics to make sure chi-square? I was going to imagine that you will be talking about some logistics, analysis, where co-founders come in, then you add all the issues, confidence in that. That's what I think. I don't know, what do you say about that?
Let's say your point. Actually, I think the cost ratios were the statistics which I got from it were similar to that of the high school. And I also supervisor was actually working out of it.
So they did not add any value. What you have just said did not add any value different from the high square value.
Yes.
I'm not too sure. That's why I tell you that. Imagine some of those. Okay. I would want to your conclusion, right? Your conclusion on page 69 is too superfluous. It's too superfluous. It would be better for someone to just pick your document, understand the highlights of the story, and that you can only get from the highlights of it. So my advice or my suggestion would be that your conclusion should be written in point form the way you presented your objective. We have write them in that same format. So you look at your objective, what result did you obtain with respect to that objective? You make a point on that. Make a point with a reason, a significance to that point. For example, let's say you tell us that the prevalence of hypertension after COVID was, I'm just giving an example, 72%. You will tell us that, then you will add something to tell why you think that it was 72%. So you make it qualitative now. You don't just make it quantitative. You add a reason why you got that result. So your conclusions should be with points, not paragraphs again as a struggling and looking for way to make the sense, right? So put them in point form. What you are getting. Same with your recommendation.
It's adjusting the way your eye is okay before you press it. Not okay, you cannot press.
Okay, I think I would want to congratulate you and your supervisor for this
Adjust the lens.
study. Like you said earlier on, there was so much
Recognize when you're
organization at the onset of COVID-19. People were escaping from hospital, and it was a really situation. Some people even died because of this type of issue, that they will not go to hospital, they were going to die in the house. And they died, and we buried them. So this was a great effort. So we hope that the information which we have had will be made available to the various health facilities. Because what we are trying to do is to improve on healthcare. So if you do it at the end of the day, you don't do so. So how do you plan to disseminate these findings? What is your strategy to disseminate these findings?
That's like the hospitals where I did the research. One of the criteria for them granting me the authorization is giving them a copy of my work to them. So I will take a copy to each of the hospitals I work with.
So you now see that point which I made on the contribution is very important. Because some people don't have time to do it, they just go to that one and pick. And your recommendation. Very important. I think another way I would encourage you is to see how much you can work with your supervisors with all the corrections you have made to publish this thing in a scientific journal. It will also help elsewhere in the world. You also write people's work now.
Yes.
You don't want them to read their own work.
I want to see mine.
Also do that. Get your name floating in the globe. Your name should not only end in
Yes, sir.
Okay, thank you so much for giving us the opportunity to learn something from you. We are grateful for that. It's now my pleasure to invite the supervisor to talk to us on this one. You are welcome, sir.
After I will deliberate, after a man of God,
It's a privilege for me to meet us and meet the family for the first time. He has been like one of the mentors in this university.
No mind for somebody. No, okay. Thank you.
Well, I'm going to take that. I wish I'm glad. And I was surprised that you had so much time because it has been held all of us
Yeah.
the past 2 weeks.
Concluded our deliberation, and we were guided by the documents which you submitted to us earlier on, for which we read before coming here, and equally your oral presentation a couple of minutes ago. While we went through these two documents, or the document and the oral presentation, we were able to establish the following facts. Point number one, that the study which you have just told us this afternoon is very relevant for the qualification for which you registered for the Faculty of Health Sciences, and also this study is of profound public health significance because it addresses issues which are contemporary, which we see every day in our settings, and which have been significantly impacted by during the peak of the COVID-19 pandemic in our healthcare system. Point number two, we also noted that the objective and methods of your study were satisfactorily and explicitly described, such that although we asked for some corrections to be made, they are well referenced and they could be repeated by anybody who would wish to do so. Thirdly, which is of most importance, we noted that the findings of this study would help us to improve on the utilization of healthcare services as we continue to go through this COVID-19 pandemic. Because at this time, we are experiencing a drop, but we don't know what may happen in the future. So I think when you take these documents to the various hospitals, there are conclusions and recommendations. It will help. And by the time the Ministry of Public Health also has access to some of this data, it will definitely help us to manage such situations. In case the situation worsens in the future, we don't know, it may change. And lastly, this panel recommended corrections which we must do to the satisfaction of the supervisor. And this panel, in its wisdom, through my mouth, recommended you to the Faculty of Health Sciences and by extension to the Senate of the University of Boya for the award of a master's degree in public health.
I'm amazed by all you do. I'm amazed you came through for me. Even in my darkest moment, Baba, you lit up my world. I'm amazed by how you care. I'm amazed you're so full of love. You've been good from distant past, and yet you're still doing good. Obinigwe, Obinigwe, Obinigwe.